Hi everybody, Dr. Kristine here at Every Family Chiropractic Center, and I am here today to talk to you guys about chiropractic in kids. So the main questions that I want to make sure to answer, because they're the main questions that we get, are why do kids need to get adjusted? Why are there so many kids in our office? And is chiropractic safe for kids? Because some people don't necessarily understand how kids get adjusted. So for those of you who are patients, you already know that we have a ton of kids at our office. It's very, very kid-friendly. We have 2 rooms specifically that the kids love, our jungle rooms decorated just for the kids. And we have so many kids that we actually have a special day each month where everyone in the office dresses up. We make popcorn for the kids. We make it fun. So yes, kids do get adjusted. There are many reasons. It is absolutely safe, and I am going to go over I'm going to go over all of that right now with you. And if you have any questions, please feel free to comment while I am going through this. So here at Every, we are in the business of whole health. So most people come into our office in order to get rid of some type of pain complaint. So that would be headaches, neck pain, back pain, etc. And don't get me wrong, we absolutely 100% want to get people out of pain. We do not want to live in pain. I don't want to live in pain, but that's not the number one primary goal that we have for our patients. Our primary goal is to remove all interference from the nervous system and get everything to function the way that it's supposed to. So that being said, since we are focusing on the nervous system, that can be affected by physical trauma, which definitely affects infants and babies and, well, same thing with infants and little kids. So I'm going to ask you then think about this for a moment. What do you really think is the first trauma that you had in your lifetime? A lot of times when I ask that, people start immediately thinking about some time where they fell off their bike or they had a sports injury or something like that. Most people don't necessarily think about the fact that the first injury to the spine is typically during birth, during the delivery process. So for women out there who have given birth, I think that maybe you can understand a little bit how that's a traumatic event, and it's very possible to have an injury to the spine for an infant. There's a lot of straining to the neck during delivery. Even more so if it's a tough delivery. So if forceps have to be used or a vacuum, that is even a much higher chance of injury to the baby's spine. And C-section, a lot of people think is not something that could cause injury because in a lot of people's minds, they think C-section, you cut the mom open, you take the baby out all nice and beautifully, all is good. That's not necessarily the case. You can watch videos of C-sections, you can see pictures, and that baby is still pulled out of mom pretty forcefully, and you got to get that neck out of there. So again, still a high chance of injury. And then it's also important to note the emotional injury that happens during a C-section as well, because that's not the baby's innate intelligence. That is their process that they innately want to do is to be born vaginally. So when they are born via C-section, there's also a little bit of emotional stress that's going on top of just the emotional stress of leaving mom's belly for the first time. It's also important for me to point out one of our other 3 causes of nervous system interference. So I just lightly touched on physical trauma to an infant during the birth process. And it's also important to think about the toxins, because toxins will cause interference to the nervous system. And in today's world, we are filled with a lot of chemical toxins. So it's in our water, it's in our food, it's in our prescription drugs, it's in our healthcare products, you name it. And studies have been done, it's a little shocking for some people to hear, but studies have been done recently to show that over 200 toxic chemicals are now present in umbilical cord blood. So before the baby is even born, there are a lot of toxins entering that baby. One study showed 287 toxins going through the umbilical cord into that little baby, 180 of which were carcinogenic, which means that they were cancer causing, and 217 of that 287 were toxic to the brain and nervous system. So wouldn't it make sense with all that physical trauma, with all that chemical overload, that it would be important for little kids to have somebody out there right away that's helping them get their nervous system to function right? For me, it makes sense. Now that I've gone through childbirth, I do want to touch on the physical trauma that can happen those first few years. This is where things start to make a little more sense, because little kids are learning to crawl, they're learning to walk, they're running into things. There's a lot of injury to the body. That's why babies are actually so flexible, move around so much, because of this whole process. If they were like us adults, falling all the time trying to learn to walk, we wouldn't be able to move. But there is still injury to the body, and injury is an injury. Every time that the joint is not functioning the way that it's supposed to, scar tissue layers up on top of it. So our goal is to stop that continual layering of scar tissue that can happen throughout childhood, even into when they're teens, young adults. We don't want these kids to basically end up in a situation that they are adults and they've had so many years of injury that they cough and their back goes out, or they bend over and their back goes out. So that has to do with years and years of damage, and it does start from the day that someone is born. Our main goal for our little ones is to get these kids into wellness care so they can grow up into nice, healthy adults, which I think is every parent's dream. Every parent worries about their child living a happy life, living a healthy life, and chiropractic is definitely one of those things that can help lead them on that route to a healthy future. So, like I said earlier, there are many kids that come into our office, and I want to kind of touch on what it is that kids come in for. I already said, we have parents who have been adjusted throughout pregnancy. They just want that healthy nervous system for their child. But we do have parents that bring their kids in for specific reasons, and I want to make sure people know those most common ones. So for infants, the most common things that we see are, colic, acid reflux, spitting up, excessive fussiness, unwillingness to sleep, etc. So you got to think that when kids are really young, they have no way of communicating except for crying. So their body has to be very clear that something is wrong and let us know right away that there's some type of nerve interference. When we are adults, we can have pressure on a nerve, we can feel discomfort, we can have some issues going on with our digestive system, and our body is very good at being able to handle that and not having such an extreme response. But initially, little baby does not want to experience any discomfort. They don't want to start their life out with nerve interference, so they're going to be very, very obvious that something is wrong. It's also very important to note that there is a very high chance that something is wrong right at the beginning, because there's an 80% chance that atlas, which is the first bone in the neck here, is out of place after birth. So baby's gonna let you know something is wrong if it's out to an extreme amount. So if you've listened to any of my other webinars, I go into this a lot. I talk about the atlas a lot because of how much it affects whole health and the vagus nerve, which I'm gonna touch on lightly in a moment. But I also want to make sure to say too, because of the fact that the body is so obvious about something being out, the body is very quick at responding when an infant gets adjusted. They don't have as many years of accumulated damage as us adults do, so the body's able to respond to an adjustment very quickly. And kind of, if I explain that a little bit more, you got to think about if you were to injure your spine, and anytime you move a bone out of place, there are muscles connected to it. So those muscles are now learning to function in a different length than what they are naturally supposed to be in. If you don't get that fixed, you are adding years of your body functioning in the improper way. So when we adjust adults, it takes a lot of time, it takes a lot of repetition to get everything to stay where it's supposed to, because the body was used to functioning improperly. With infants, they have not had years and years of functioning improperly, so it's usually a relatively quick, compared to an adult, fix for what's going on with them. Once kids get a little bit older, our symptoms that we see with our kids of why they're brought into the office tend to change. So instead of that fussiness, colic, we start to see more behavioral symptoms going on. So that could be hyperactivity, aggression, and anxiety. And yes, when I say anxiety, I mean anxiety. I have some people who try to say that kids don't get anxious, but I highly urge everybody to watch the other webinar on anxiety, because I do go over a lot of the signs of children who experience anxiety. And I use myself as an example because when I was in elementary school, when, life is great, there's not a whole lot to worry about, I was 100% experiencing anxiety. I had these crazy fears about what if a fire happened in my house? What if somebody broke in? What if I get cancer and die? Anytime I would leave my parents, I'd have a extreme fear that something could happen to them. And kids don't verbalize these things very well. So a lot of parents don't necessarily understand that their child is experiencing some significant anxiety. So anxiety presents differently in a lot of kids. It's our biggest thing that we do have kids coming in for, along with some other behavioral issues. And one of the ways that chiropractic strongly helps with that is by adjusting the neck, that use of getting the vagus nerve to function properly, which is a nerve that comes out from the base of your skull. It calms down the nervous system. So a lot of these kids who are experiencing behavioral issues are in sympathetic overload. So sympathetic is your fight or flight mode. So they're in constant stress survival mode. And when we get them adjusted, we are able to tune that down. And I'm also going to route you too, when I talk about this, to our Perfect Storm webinar, because the Perfect Storm webinar is specifically for these kids that are in sympathetic overload, who have been bombarded with a lot of physical trauma and emotional trauma or toxic trauma before they're born, and develop a lot of symptoms as a result. So it's important to know that little kids can get help from chiropractic when they are experiencing behavioral issues. And I do want to point out a couple symptoms so that you don't have to go watch my whole webinar on anxiety, but some of those things are extreme fears, like I just mentioned, really terrible separation issues with their parents, night terrors, pulling out their hair. Those are some of the common ones that we see. And, they just need a little bit of help calming down that nervous system. We also get a lot of kids who come in with bedwetting, digestive issues, severe allergies, issues with sleep. Those are just a few of them. And, like I said in the beginning, our goal is to get that nervous system to function properly. So even though these kids aren't experiencing pain, their organs, their nervous system, their nerves, they are feeling the effects of things not functioning the way that they should. And our goal is to get them feeling healthy. We don't want little kiddos feeling sick and not being able to sleep, and no, that breaks everyone's heart. So now that I've kind of explained why kids get adjusted, why it's important for kids to get adjusted, I'd like to address how getting adjusted is safe for kids. A lot of people just immediately think of kids getting adjusted the exact same way that adults get adjusted, and that's not necessarily true. I do want to, though, sidetrack here a little, that we don't necessarily adjust a lot of our kids manually. We are an instrument-based practice, but those that do adjust manually, I want to at least ease your mind that when chiropractors are adjusting little babies, they're not adjusting them the same way as they adjust adults. They are using about the same pressure that they would do if you were checking to see if a tomato is ripe. That's all it takes to hold onto a bone to get bones to wiggle their way back into place. It's very painless. A lot of kids smile throughout the adjustment. You'll see them pause and make this face like they know they're getting corrected. We have a couple that I'll do this to in the office, but the vast majority of our patients are actually adjusted with an instrument. And that's because that goes along with our technique at our office called Koren Specific Technique, KST for short. And the instrument that we use is called an arthrostim. So an arthrostim, it looks like a crazy huge kind of scary instrument. We call it the tap tap machine to our little kids so they don't get freaked out by it. But it's just a really fast tapping motion, really soft. It's under the pain threshold. What's really great about it is that we can adjust everything in the body. So sometimes we are trying to get some stimulation into that belly, and kids definitely, they laugh a lot when we do that. We can adjust all the cranial bones, which is huge. We have seen crazy differences in the shapes of cranial bones while children are going through the healing process, and having something so light that we can adjust everything without any pain is really beneficial. So kids really like getting adjusted at our office. The babies like getting adjusted, and we make it fun. So for those kids that are experiencing a lot of hyperactivity, or they are a little bit more fearful about life, like I said in the beginning, we have fun kids rooms. So occasionally we do have times where we are adjusting these kids while they are reading a book or while they're playing with a toy. We kind of work around whatever a kid is going through to make sure that they can get adjusted and get adjusted safely and enjoy getting adjusted. It's one of the coolest things when we come in and a parent tells us that their little child was telling them that they need to go in and get their taps so that they can feel better. It's really neat that a child is learning to be in tune with their health at such a young age, and that's our primary goal. So I hope that I answered some good questions about why kids get adjusted and how safe it really is for kids to get adjusted. I would love to answer more questions, so if you have any, please feel free to comment on this video, message us on Facebook privately, or you're welcome to, of course, to give us a call if you have any other questions, if you want a consult or anything like that. So that wraps up my talk about chiropractic in kids, and I hope that you all have a fabulous week. Bye.